Hello and welcome back to the YouTube channel of Invisible Disability Awareness. In this episode, we will be discussing anxiety and depression, which are two common invisible disabilities that fall under the category of mental health. We will also be having a conversation with Erin Cotillo, who will share her own personal experience with both of these invisible disabilities. Before we meet Erin, I am going to introduce our episode question and provide some background information on anxiety and depression. After having a thorough conversation with Erin, we will be able to come to some conclusions regarding this episode's question. So, as you can see, we have our main question of the episode up on the screen here. It reads, is there a stigma surrounding mental health and invisible disabilities, such as depression and anxiety? And if so, how does this stigma impact those with invisible disabilities, and how can we decrease this stigma among society? I think it is extremely important to bring awareness to the way society treats those with invisible disabilities because it may allow their perspective to change on these issues. Drawing attention to the way society stigmatizes and invalidates mental disorders will encourage the public to consider how their current mindset and inaction impacts those who have invisible disabilities. Throughout this episode, I argue that there is a stigma surrounding invisible disabilities such as depression and anxiety, and this stigma negatively impacts those who have invisible disabilities. Before getting into stigma, I think it is valuable to go over some basic terminology regarding invisible disabilities, along with some broad information regarding depression and anxiety. According to the Invisible Disability Project, which is a project that tears down the invisibility imposed on individuals who have unseen disabilities, an invisible disability is any physical, mental, or emotional impairment that goes largely unnoticed. They state that an invisible disability can include, but is not limited to, cognitive impairment and brain injury, the autism spectrum, chronic illnesses like multiple sclerosis, chronic fatigue, chronic pain and fibromyalgia, deaf or hard of hearing, blindness and or low vision, anxiety, depression, PTSD, and many more. It is highly likely that you know many people in your life who have disabilities that you're unaware of. Because these disabilities cannot be seen physically, some members of society invalidate these members' conditions and treat it as a personal issue rather than a societal issue, and they allow stigma to guide the way they view individuals with invisible disabilities. Therefore, the members of society who have invisible disabilities face many barriers to personal relationships, healthcare, laws, and policy, education, and more. Now that you hopefully have an understanding of what an invisible disability is, I am going to introduce you to depression and anxiety. It is highly likely that we all know someone in our lives who has been diagnosed with depression. According to the CDC, about 1 out of every 6 adults will have depression at some time in their life, and depression affects about 16 million Americans every year. Something that provides perspective is the fact that anyone can get depressed. This disability does not discriminate, and depression can happen at any age, regardless of your life situation at the time. The Mayo Clinic defines depression as a mood disorder that causes a persistent feeling of sadness and loss of interest. Also called major depressive disorder or clinical depression, it affects how you feel, think, and behave, and can lead to a variety of emotional and physical problems. You may have trouble doing normal, every day-to-day activities, and sometimes you may feel as though life isn't even worth living. Some symptoms of depression might include feeling sadness, hopelessness, loss of interest, loss of sleep, and a reduced appetite. Symptoms vary from person to person, and many people have very different experiences with this mental disorder. As for the causes of depression, doctors believe it may have something to do with biological differences, brain chemistry, hormones, and inherited traits. For many individuals, their symptoms of depression are usually severe enough to cause noticeable problems in day-to-day activities such as going to work, going to school, participating in social activities, or even maintaining relationships with others. What a lot of people have a hard time understanding is that individuals with depression cannot simply just stop feeling the way that they're feeling. They cannot just snap out of it. And it is also equally important to remember that depression is in no way a weakness. Fortunately, many people with depression do get better through medication or psychotherapy. But this doesn't mean that they don't battle with this invisible disability throughout the entirety of their lifetime. The CDC also notes that many people who experience depression also have other mental health conditions, such as anxiety disorders, which go hand in hand with depression. This leads us into our discussion about anxiety. It is human to experience anxiety occasionally. At some point throughout our lives, we have all felt anxious or uneasy or nervous about something. However, according to the Mayo Clinic, people with anxiety disorders frequently have intense and excessive and persistent worry and fear about everyday situations. And anxiety disorders involve repeated episodes of sudden feelings of intense anxiety and fear or terror that reach a peak within minutes. These can be referred to as panic attacks. A few of the common anxiety symptoms include feeling nervous, tense, having an increased heart rate, feeling weak and tired, and having trouble concentrating. Similar to the symptoms of depression, the symptoms of anxiety also interfere with daily activities and are extremely hard to control. Individuals who have an anxiety disorder may avoid situations or places just to prevent these feelings that they experience. There are multiple forms of anxiety, such as generalized anxiety disorder, social anxiety disorder, specific phobias, and separation anxiety disorder, and individuals can even have more than one of these types of anxieties. According to the Mayo Clinic, the causes of anxiety are not fully understood, but some doctors believe it is brought on by traumatic events and inherited traits. Anxiety and depression are closely related, as having anxiety can lead to depression. According to the Anxiety and Depression Association of America, despite their close relation to one another, depression and anxiety disorders are different, but people with depression often experience symptoms similar to those of an anxiety disorder, such as nervousness, irritability, and problems sleeping and concentrating. But each disorder has its own causes and its own emotional and behavioral symptoms. Overall, as stated before, many people who have depression also have a history of anxiety. But with that being said, there is no evidence that one disorder is causing the other, despite many people suffering from both. Now that you have a deeper understanding of what these disabilities entail, we can begin to address our question regarding stigma and invisible disabilities. So the first part of the question was, is there a stigma surrounding mental health invisible disabilities, such as depression and anxiety? According to an article in the Indian Journal of Psychiatry called Stigma of Mental Illness, an Interventional Study to Reduce Its Impact in the Community, the authors say that stigma is a negative differentiation attached to some members of society who are affected by some particular condition or state. Based on research, significant health associations, such as the American Psychiatric Association, believe that stigma is still widespread among invisible disabilities, causing people with mental disabilities to be marginalized and discriminated against in various ways. The American Psychiatric Association states that more than half of people with mental illness don't receive help for their disorders. They believe the reason individuals avoid or delay seeking treatment is because they fear how others will view them and they fear what others will think about them. In the words of the American Psychiatric Association, this is because stigma, prejudice, and discrimination against people with mental illness is still very much a problem. Along with providing research, the American Psychiatric Association also provides a thorough examination of stigma itself and what it is and what its root causes are. I believe a brief discussion of this is significant to the topic of this episode, as our question of this episode revolves around stigma. According to the American Psychiatric Association, stigma stems from a lack of understanding or fear, and misunderstandings and fear can arise due to inaccurate or misleading media representations of mental illness. The American Psychiatric Association states that while the public may accept the medical or genetic nature of a mental health disorder and the need for treatment, many people still have a negative view of those with the mental illness. On the American Psychiatric's website, they provide a really useful chart which explains the various types of stigma. This includes public stigma, which is the negative attitudes people have about mental illness. It also includes self-stigma, which includes the negative views the individual with the mental illness has about themselves. And it also includes institutional stigma, which is systematic and involves government and organizations limiting opportunities for those who have mental illness. By looking at the chart, you can see how all three forms of stigma have a negative impact on those with mental illness. Now that we have established that stigma is still prevalent among invisible disabilities such as depression and anxiety, we can begin to address the second part of our question, which is, how does this stigma impact those with mental illness? So whether stigma is obvious or subtle, it can harm the lives and well-beings of those who have mental illnesses. In Chapter 9, Barriers to Effective Treatment and Intervention, in the book Reducing Suicide, A National Imperative, the authors of this consensus study state that consequences of societal stigma for those with mental illness can be severe. These consequences may include diminished opportunities, lowered self-esteem, shame and concealment of symptoms, and lower help-seeking behavior. The impacts of stigma on those with mental illness are negative, and they may even cause an individual to not seek the treatment they need. This is evident when we come to realize that people with mental illness receive less medical services than those who are not labeled as mentally ill. Even if individuals do start to do treatment, stigma may be what causes them to discontinue their participation in getting help. Overall, stigma has negative mental impacts on individuals, but it also functions to take away rightful opportunities from those with invisible disabilities, such as employment and socialization. In a blog article called Don't Invalidate My Depression by Juliana Vaughn on the site of the National Alliance on Mental Illness, the author, Juliana Vaughn, opens up about her personal experience with stigma invalidating her depression. When Vaughn first started having signs of depression, she told her dad about it, and her dad looked at her and said, "You're just being a girl." Vaughn states that a question I asked myself for probably the entirety of my teenage years is this mental health related, or am I just being a perfectly normal hormonal teenager? She explains that this questioning of her mental illness made her blame her emotions on hormones. She further expressed that having no support with her mental illness made things much worse for her. She states that I had to force myself to be content with the fact that, hormonal or not, depressed or not, this was just how I am. Similar to Vaughn's experience with stigma and invalidation, Gina Florio, the author of Say This When People Invalidate Mental Illness, explains that she also experienced the impacts of stigma. She stated that, having suffered from anxiety and an eating disorder for more than 10 years, I know what it feels like to have people around you completely diminish your mental illness, like it's nothing more than an itch that can be willed away with a good scratch. From the experiences described by Vaughn and Florio, it is obvious that stigma has a negative impact on individuals with invisible disabilities. In addition to Vaughn and Florio's take on stigma, our guest speaker Erin Cotillo is with us here today to discuss her invisible disabilities and the struggles she has had to conquer as a result of stigmatization. Hi Erin, welcome to the Invisible Disability Awareness YouTube channel. I would first like to start by thanking you for coming in and speaking with us. For those of you who don't know, Erin is a senior at JMU, graduating in about a week. Could you tell us a little bit about your major and what your future plans are for after college?
So I'm a psych major, and my plans after college right now, I've applied to 2 jobs. One of them is a crisis intervention counselor, where I would just be going out to different people who are in like a different mental crisis. And then the second one is to work at a psychiatric unit at Jefferson University Hospital.
Okay, awesome. So because you are planning on working with mental health in the future, I assume that you've had past experiences with mental health with others. Could you maybe give us an overview of your own experience with invisible disabilities, such as mental health issues as depression and anxiety, and what do these conditions mean to you?
So I've definitely struggled with my own like problems with depression and anxiety. I think I've had anxiety like my whole life. I've always been just really anxious, and that's caused me to be like a really big like planner, and like I have to like know answers to things. Not knowing really is something that just triggers me so bad. And then depression is something that I think kind of onset for me in college, and that happening sort of made me want to get into the field early. So I've also had experience working with youth that are in foster care in New Jersey. They have like different mental disabilities. So some of them have like conduct disorder
Okay.
and a lot of different trauma backgrounds.
Mhm.
So that's just kind of been some of the experience I've had.
Okay, I think it's great that you're trying to work in a field that means so much to you.
Mhm. Yeah.
I think that's awesome. So you previously mentioned that you have had experience with both anxiety and depression.
Mhm.
When did you realize that these were things that you needed to address?
So I kind of started to realize it at the end of my freshman year. I started noticing, like at college, I started noticing a change within myself. I just constantly was thinking like everyone was out to get me for some
Mhm.
reason, and I didn't really know why I thought that. And then that summer, it just started getting progressively worse. I just remember like being extremely irritable, like not wanting to come out of my room ever, and just it was just really strange. There was something like a shift, something was like off within me. I think when I really started realizing I had depression and that like going on antidepressants could be something beneficial for me was when I took my abnormal psychology class and my professor started listing like the symptoms of
Okay,
depression,
okay.
and every single one of them was me.
Okay.
And that's when I was like, wow, okay, this is something I could probably try to like fix.
Okay, and so before you had that realization, did you question if it was just, like a hormonal thing, or if you were just like, were you kind of thinking like, could this really be depression, or is this just me overthinking?
Yeah.
So did you go through like a struggle kind of deciphering what it actually was?
Oh, definitely. I think it comes with the lack of like knowledge and experience too, and you always think like, oh, it can never be me.
Yeah.
You always
exactly.
think it's never me.
Uh-huh.
And a lot of the times depression, anxiety, whether it's genetic or just comes on within your 20s, like it can stem from other things. Mine personally stemmed, I think, from a post-traumatic stress disorder.
Okay.
So those were kind of like comorbid things that
Okay.
came with that.
Okay.
But yeah, I had a lot of different doubts and like a lot of people sort of telling me, oh, like, no, you're fine.
Well, thank you for sharing that.
Mhm.
So when you did realize that your anxiety and depression were things that you needed to address, were you initially reluctant to get help due to the stigma surrounding mental illness?
Honestly, no, but that could be just because I'm lucky and I'm also a psych major.
Mhm.
So it's one of those things where I knew a lot about it already,
Mhm.
and that's pretty uncommon with
Yeah.
people that have different mental illnesses like that. A lot of people, I think are really reluctant to get help and are scared,
Mhm.
honestly, of what going to therapy looks like.
Uh-huh.
And going on medications and what that looks like. And
Yeah.
there's definitely a lot of stigma behind going on medications, and that I
Mhm.
personally did experience.
Okay. So I think it is amazing that you were initially not reluctant to get help despite the stigma surrounding mental illness. But have you been stigmatized in the past or currently due to your condition? And if so, what effect did this have on you? And have you met people along the way who have tried to invalidate your condition and struggles by just suggesting maybe that you're being dramatic or that you're just being a girl or something like that?
Yeah, actually. So my sophomore year is probably when my depression was at its worst.
Okay.
At that point, I was definitely in some like maladaptive behaviors. I was self-harming. Like it was a lot of just really bad stuff going on. And I got to a point where I did realize like I needed to get help, but at the same time, like my friends did start noticing a change in me, like in a bad way, like when I
Okay.
was really depressed.
Okay.
And they attributed it to the relationship I had with a boy at a time, and
Okay.
they would yell at me, be like, "Why are you hanging out with that guy? Like that's the reason you're acting like this. You just need to get over it." So everyone assumed like, because I wasn't really fully aware of why I felt the way I did, and them telling me that it's because of a boy when I didn't really think that's why, it made everything more confusing for me.
Yeah,
and it
sure.
definitely invalidated my experiences, and it definitely made me feel like I didn't have anyone to talk to.
Okay.
So as time went on, like people were drifting away from me because of that. Like they were all like, "Oh, she's just being like a certain way because of this boy. Like she's just changing. Like I don't even know who she is anymore." And there was like only a few people I confided in anymore because it really affected how I trusted people, and it really hurt to get yelled at like that for something I didn't even know how to control yet.
Yeah.
So towards the end of that semester, there was one point where a big group of people like decided to pull me into a room, and they were like, "Listen, so we've all been talking about you," and like as it is, that already feels like crap,
Yeah.
like having
Yeah.
a bunch of people come up to you and be like, "Listen, so we've been talking about you. We notice you're not the same, and we all think that you should leave school, and that you need to take a year off because you're just not okay." And I do, looking back on it, think that just came from a place of concern, and I'm able to forgive that in a sense.
Yeah.
But they gave me some pretty dangerous advice, being that, like, you know, leaving school and then not continuing my education. And they also, at that point, I remember being like, actually, I've been talking to my mom a lot, and her and I both think I should go on antidepressants. So this was the point where I really wanted to do something about it, and I was sick of feeling the way I felt. And they were like, well, actually, no, like, antidepressants make people worse. So we don't think you should go on that. And that was really also invalidating, because you would think, like, a group of friends would be like, okay, you know what, like, we'll be there for you through that, because that's going to be a difficult transition, and, like, if that's what you think is best for you, then pursue that. But they were like, no, like, antidepressants make people worse, like, that's not good. Like, and I honestly think that just came from a lack of information and education. And I think that if I did listen to that advice, unfortunately, I really don't think I'd be here anymore. And that's really, like, it's an awful thing to say, but it's really dangerous advice that, honestly, unless you're a medical professional, you have no room to give someone.
Exactly. I think that people just need to be there to support you.
That's all you can do.
Not try to intervene and give their own medical advice when they aren't educated on that.
And now that I am, you know, medicated and I am in therapy, and, you know, I'm pursuing all these amazing things, like with my career, those same people are like, wow, like, you seem just so different now. I'm like, yeah, because I didn't take your advice.
Exactly. So
look at me now.
Moving forward, did you eventually find that good support system and, you know, people who were there for you and you know, supporting you along your journey in college with dealing with invisible disabilities? Did you eventually find those people?
Oh, I think I always had those people, and I know exactly who they are, and I live with them. So, but yeah, I've always had those people along the way. It definitely was difficult, though, just like having another group of people at the time that were just complete opposite end of the spectrum of like where they thought I should be. But I did always have that really good support system, and I'm very fortunate for that, because a lot of people don't have that. And fortunately too, like, my mom has always just been like my best friend. She's always been so supportive of anything I wanted to do and anything regarding my mental health, because I know my family was getting concerned too, because with depression too and anxiety, a lot of like your appetite changes a lot, and I lost like 20 pounds. I was just so sick, I think. I know I was really fortunate looking back, like, just to have the support system I had, and especially going through that, because if I had no support system and just like people negativity, I don't know, like, how anyone could handle that.
I mean, I think the most important thing is just having people around you that, you know, support you through everything, and that don't invalidate the way you're feeling. Because I think that creates so much confusion within your own self, which doesn't help anyone.
And then it makes you doubt, you know, getting treatment, which is so necessary for some people.
Well, thank you for sharing that experience. I think a lot of people who watch this will be able to learn from that, and maybe they are in the same position that you were in, and they can understand that, you know, there are people out there that will support them and will understand them.
It's actually amazing too, if I just want to add, like, every May is a mental health awareness month, and I'll usually post something just like in regards to my own journey. Like, it's not over, it's always going to be something I have, but I'm definitely way better at dealing with it now. So I'll always just like post a little like something about it, and it's amazing the amount of DMs I get just from people I would never expect that are like, hey, like, I'm really appreciating you sharing your story, because I've been so scared, because I've been feeling like this and I just don't understand. And like, I've had people too DM me being like, hey, is it okay if I send your post to my friend, because she's dealing with something like this, and I just think seeing this could help her. And I really do think just creating awareness and, you know, just a support system, like I said before, is just so important. So thank you again for sharing that. So how are you currently coping with anxiety and depression, and is this something that you think you will struggle with for your entire life? Will it always be basically something that you're going through and always be a part of your everyday life? So how I'm coping with it now, I'm currently medicated. I'm on antidepressants, and they work wonders for me. And for now, I think I'll stay on them. I don't know like when I'll be ready to get off of them, just because there were times that I thought I was ready, and I would get off of them like the wrong way. You're supposed to titrate down your dosage, but I just stopped taking them once, and that was stupid. But I think I probably will continue taking them for a while. I hope that maybe not forever, but also if that is something that I have to do, it's something I have to do, and I'm not that upset about it. I think it'll definitely, anxiety especially will be something I deal with for the rest of my life. I think I might have depressive episodes here and there, but I think that's also normal sometimes, like to not feel happy all the time. But I think, I think it might be something I deal with, but I am okay with that.
Yeah.
Like, I've come to learn how to better handle it, and just like different coping mechanisms, like going to therapy, talking to someone when you feel that way rather than bottling it up has been something that's really beneficial.
Yeah, and I think like definitely
and learning more, just my major, and like going into like the work I'm about to go into, and just know that my experiences could be just so impactful for so many people. Is something that makes me like really okay with it.
Yes, and the thing is, and basically the purpose of this channel is to let people know that it is okay, and it's not something to be scared of, and you know, it's not something to hide and be afraid of opening up about. So you mentioned at the beginning of the interview that your future plans include doing something in the field of mental health and just working in that profession. So is there anything you would like everyone to know about, you know, different treatments for mental health and visible disabilities, and just kind of what would you like us to be aware of in that sort of aspect of things?
Yeah. So, like I said, one of the jobs that I interviewed for is it's called a mental health technician in Thomas Jefferson University's hospital in their psychiatric unit.
That's awesome.
That's something I'm so excited. I'm really hoping I get that job. Fingers crossed. You'll find out eventually. Anyway, but I'm excited about that. But there's one thing that I think people should definitely be aware of, like regarding stigma and mental health work. I think that working in a psychiatric unit, and psychiatric units in general, like psych wards as people like to call them, are depicted so terribly just in the media.
Yeah, I agree.
I think people with schizophrenia and, you know, antisocial personality disorder, all these different things are depicted just like the movie Split, where they're literal monsters, and that's just not how people with these mental illnesses are. And I think people like to attribute different mental illnesses to like personality traits, such as like people think schizophrenics are all violent, and the majority of schizophrenics are actually non-violent. And the work that goes on in psychiatric units isn't just like restraining and sedating people. That's a very last resort thing. And the majority of the time, the only reason why schizophrenics become violent, and a lot of time the only reason schizophrenics become schizophrenic, is due to trauma. And they may have like a visual hallucination, which makes them think they're getting attacked, and that's why they act out. And it's important to remember, like, those people are not violent, and they're not monsters. They're still humans. And, you know, schizophrenia literally means split mind. It's a chemical imbalance with your mind where you have these different like auditory and visual hallucinations. I think people just forget that different mental illnesses like depression, like not all depressed people are lazy. They just lack serotonin, and that affects their sleep and makes them exhausted all the time. Not all anxious people are high-strung type A. Like they just have a chemical deficiency where they need extra medicine for that. And I think people just forget that going to a psychiatric unit to get treatment, that's not a bad thing. There's just so many different, there's group therapy, there's rehabilitation, there's social workers, so many different things in hospitals that can be beneficial for people. And then there's also different medications that people can go on. I just think people forget that, you know, psychiatric units aren't, you know, like the haunted houses you go in on Halloween. It's not an insane asylum. They don't do lobotomies. It's really for people who are just struggling and need that extra support.
And I definitely think the
picture painted is awful.
And the lack of understanding definitely comes from how it is portrayed in the media.
And it attributes to the stigma terribly. And unfortunately, all you see on the news is the worst of the worst. So you'll see the violent schizophrenic on the news, sure, but that's not the majority of people with schizophrenia. Some of them are actually like the nicest people you could ever meet.
Exactly. Well, thank you again for sharing your insight on that, and I wish you luck with your future plans.
Thanks.
So to conclude the interview, I would like to know, what is your advice to others who may feel alone with their anxiety and depression? You know, what would you say to someone who is being stigmatized due to their condition, or what would you say to someone who has experienced invalidation of their feelings and of their, you know, emotions because of the stigma? So basically, what is just your advice to others who are feeling lonely in this situation?
I hope anyone who does end up seeing this, or just anyone in general who's feeling depressed, anxious, confused, not sure what they're feeling, just I would really encourage you to talk to someone trustworthy. You know, it's not really good to talk to people like that you can't trust, and people that you know are a little bit on the judgier side. It's good to talk to someone trustworthy in your support system that, you know, they can really help you. And then also, if you really feel like you have nobody in your own personal life to talk to, there's hotlines. I know it's so intimidating to call a hotline. I've done it before, and it's actually really nice to have someone invalidate you. Because if anyone who's feeling invalidated or just confused, like, you are valid, you are worthy of being here. You deserve a chance at life, and you deserve to be able to live healthy and happy and not, you know, be stigmatized for your condition, because really it's normal. It happens. Like, these are all things that are completely out of your control in the sense that, like, you can't help having depression. But there are things and steps that you can take to feel better and to feel more functioning. And I think it's the first step is talking to somebody, anybody. And then if you really feel like you can't, calling a hotline, calling a family member, and then you can even, you know, find therapists and stuff online. Psychology Today has a lot of great therapists that you can find that cover insurance and that take Medicaid. So there's plenty of options, even for people who think they can't afford it. There are ways, and I hope people know that. Anyone who's being invalidated, just don't listen to them. It'll be fun.
Thank you so much for that wonderful advice. I think it is awesome that you have come in here and just given us some insight into your own experiences and
I'm happy to
your
do
future
it.
plans. I really think just for people viewing this who may be struggling, I think it will be really helpful to hear about your own experience. So once again, thank you. And
thank you for having me.
And I hope everyone else learned just as much as I did from having this talk with you.
Thank you.
So our discussion with Erin leads us to the third and final part of the initial question I brought up for this episode, which is, how can we decrease and diminish this stigma amongst society? To start, researchers suggest that public awareness and education are important strategies in reducing stigma. Earlier in this episode, I mentioned an article found in the Journal of Psychiatry called Stigma of Mental Illness, an Interventional Study to Reduce Its Impact in the Community. This article discussed a study conducted in a rural and semi-urban community in India. In this study, the researchers found that people in the rural and semi-urban community have a stigmatizing attitude towards mental illness. So they developed an intervention package for those who encourage the stigma surrounding mental illness and then studied its impact. The researchers gave out a survey to a large group of individuals regarding mental illness. Based on the survey responses, they created an intervention package for these same individuals, which included information on the causes of mental illness, common myths and stigma in the mental illness community, consequences of stigma, treatment of mental illness, and facilities available for treatment. After the intervention package was complete, the individuals received a post-survey to complete. From the post-survey, they found that the intervention package was successful, as there were significant changes in attitudes towards some aspects of mental illness. In conclusion, these researchers suggest and recommend educational programs for the public about mental illness to dispel the myths. They also suggest organizing mental health services and changing media presentation of mental disorders to reduce stigma. Furthermore, identifying misconceptions appropriately, communicating correct information, and building awareness around invisible disabilities significantly reduces stigma. The particular research I did in order to conduct this episode really gave me an abundance of hope for the members of our society and for those who live with invisible disabilities. As advocates for those with depression, anxiety, and any other disability, we must take a stand against stigmatization and invalidation of conditions and create an environment where each and every individual can live comfortably with who they are and have equal access to all opportunities. I truly hope you gained some valuable knowledge and perspective from watching this episode, and I encourage you to continue to keep up with this channel. Thank you again to Erin for sharing her story with us, and thank you so much for taking the time to watch this video. See you next time on the Invisible Disabilities Awareness YouTube channel.